Okay. Hello, everyone, and welcome. And thank you so much for joining us today for this Retina UK webinar, Opticians Appointments Explained, What to Ask and Why It Matters. I'm delighted to see so many of you here, whether you're living with an inherited retinal condition, supported someone affected, or simply keen to learn more about navigating eye care. Today's session is all about empowering you with the knowledge of confidence to make the most of your interactions with optometry professionals. For many people living with inherited retinal diseases such as retinitis pigmentosa, Stargardt disease, Usher syndrome, and others, understanding what happens in an optician appointment, what tests are available, and what questions to ask is vital for staying on top of your eye health and functional vision. We want you to feel confident and informed as you engage with eye care services. Opticians and optometrists play an important role in your eye care journey. They're often the first health professionals who can spot changes in your visual function or retinal health, and they can help guide referrals to hospital, eye specialists, or low vision services when needed. They can also support you with practical approaches to make the most of your remaining vision and connect you with the tools and services that help in daily life. We are joined today by Ashish Chokshi, Principal Optometrist and Optometry Lead for Medical Retina at Moorfields Eye Hospital, and also a community optician practice owner. Over the next hour, we'll be covering crucial topics such as what to expect in an optician's visit, why regular eye examinations matter and how they contribute to early detection and ongoing eye health, key vision tests and what they measure, how practices adapt their assessments for the IRD community, how optometry works with low visual services to support independence, and practical tips to get the most out of your appointments. We're also joined by two community members, Joan and Anna, who will kindly share their journeys through clinical care, and we'll also end with a Q&A so you can ask our panel your questions. Please feel free to pop your questions into the Q&A tab, which should be at the bottom of your screen, and we'll get to those questions at the end of the webinar. If we run out of time, we'll make sure to try and follow up after the webinar. We hope you'll come away feeling informed, supported, and ready to take those next steps in your eye care journey. Thank you again, and let's get started. So I thought we'd first start with a couple of introductions. And Ashish, would you kindly briefly introduce yourself and tell us about your work?
Sure, thank you. It's great to meet everyone. My name's Ashish Chokshi. I'm the Optometry Lead for Medical Retina at Moorfields Eye Hospital, and I also own my own independent practice, Dark Eye Clinic, which I'll run alongside with my wife and fellow optometrist. I've been an optometrist for a number of years now, worked across all sorts of community settings, and yeah, it's of course fantastic to be here and speak to all of you.
Thank you. Thank you for joining us. Joan, would you like to introduce yourself now and tell us also about your sight loss condition? After Joan finishes, Anna, could then you follow?
Okay. Good evening. My name is Joan. I was diagnosed with a hearing impairment when I was 5 years old. And when I was 17, I was diagnosed with retinitis pigmentosa. So they concluded I had Usher syndrome type 2A.
Perfect. Thank you so much. Anna?
I have Usher syndrome type 1D. So.
Brilliant. Yeah, thank you. Thank you so much. Right, now let's get into some of the questions that we have regarding our topic today. And Ashish, I'm going to come to you first. Could you explain a little bit about what optometrists do and how this differs to the role of an ophthalmologist?
Absolutely. So optometrists fundamentally, they primarily, we manage during our undergraduate training, we effectively go through a number of modules and a large amount of training around various eye conditions. We help diagnose, manage, and screen a variety of eye conditions. The difference between an optometrist and ophthalmologist, the optometrist wouldn't have done a medical degree. We effectively skip the rest of the body and go straight to the eye. And whereas an ophthalmologist would have gone through their medical training and then subspecialized in the eye, so they'll be able to do surgery, for example. Optometrists wouldn't do surgery. The within optometrists work along many different settings. So we work in hospital settings as well as community practice. Primarily within the community. If you've been to an optometry clinic before, an optician's appointment before, you'll know we do a series of tests, understand the health of someone's eye. We would do a refraction, so understand what a prescription pair of glasses or lenses might look like, work with a variety of optical appliances, so spectacles, contact lenses, low vision aids as well, and help effectively maximize vision across the board. So that's the main difference between an optometrist and ophthalmologist.
Perfect, thank you. And Joan, when you first started attending appointments, did you understand the difference between these roles?
Not when I first went. I just assumed that an optician did everything until I was referred to Moorfields Eye Hospital, and then I understood a little bit more.
Yeah, exactly. And that's kind of one of the reasons we're having this discussion tonight, is so that we can, like I said, outline the differences and what each can offer. Now, Ashish, back to you. How much does a typical eye test cost? So as well as free NHS eye tests for people registered as sight impaired or severely sight impaired, what does this involve? Is there any additional costs that are not covered by the NHS?
It's a great question. So as far as NHS funded eye examinations are available across the board for practices that offer those. The subsidy effectively covers a crucial set of tests as per General Ophthalmic Services regulations. That includes a visual assessment, an assessment of the muscles around the eyes, an understanding of what's happening at the back of the eye, and a series of other examinations as clinically required for a patient. Beyond the NHS systems, you can get a private eye examination as well. The costs of those can vary from anything from £10 to £20 all the way up to 150, extending up to £300 as well. There'll be some clinics that offer NHS examinations, some clinics won't, some practices won't. Within the NHS subsidised eye examinations, for those registered as severely sight impaired or sight impaired, that would include a very similar battery of tests. You would be doing a refraction, an assessment of the back of the eye, and an understanding of general eye health. Anything that can't be managed in the community or that needs further assessment would be referred into the hospital eye service setting, in which you'd have your comprehensive low vision assessments and of course assessments with an ophthalmologist as well. So arguably for those registered severely sight impaired or sight impaired, you can get eye examinations effectively free at the point of care. And for those that aren't, there are free examinations available. So NHS subsidised examinations available for certain people that are eligible for them. So if you're receiving certain benefits, for example, yes. If you're over a certain age, so over 60, under 16, or in full-time education up to the age of 18. So there are specific circumstances in which you'd be eligible for an NHS funded eye examination.
Okay, perfect. And would somebody know if they were eligible for these, or would this be a conversation they would kind of have in their appointment?
So it would be had during the booking process for wherever you decide to have your assessment or eye examination. Typically on booking, most people will ask, do you know if you're eligible for an NHS funded eye examination? Right. If you're unsure, then they can read out the criteria to you, and the criteria is also available online as well. So if you were to look up NHS funded eye examinations, there's a clear set list of criteria available on the NHS websites as well.
Great, that's good to know. That's a good tip. Now, Anna,
just to add, in terms of optical appliances, so if a pair of glasses are required, again, for very similar subsets, so if you're eligible, if you're in receipt of certain benefits, for example, then you can get a subsidy towards the cost of eyewear and so for example, a pair of glasses and lenses, for example, as well. So that's also an option.
Great, another good tip to know, thank you. Now, Anna, was navigating eligibility for free NHS tests confusing at first for you, or did you have an optician clarify this for you?
Well, so when I aged from children's kind of coverage to adults, which was quite recently, our opticians at my last appointment in the children basically explained that for the next round of appointment I would lose certain things in NHS, but I'd have other coverage elsewhere.
Okay.
So they made sure to explain all of that. It's
Okay.
different because mine's a fully private optometrist compared to others.
Right, yeah. And was that confusing, do you think, or was it explained so well that you kind of understand what was going on?
It was explained to an extent that I could understand what was going to happen next.
That's great, and that's really helpful. Joan, can I ask, what was your relationship with your optician appointments early on in your diagnosis? Did you attend regularly?
Well, yes, I did. I mean, the first opticians that I visited was near my home where I was living with my parents, and they were the ones that referred me to the Moorfields Eye Hospital, rather, I should say my GP and then Moorfields Eye Hospital from there. And then after that, when I got married, I had a different opticians, and I've been with them for 50 years. So they know me very well. And I've been going every 2 years. So it's been very regular. And I have to say that I put my whole trust in them as well. So I'm hoping that I got it right.
I think if it's 50 years, it sounds like you have been. Ashish, now how does someone know if they're due an optician appointment, and how regularly should they have one?
So typically adults between the age of 18 and 60, in the absence of any other eye condition, should really have an eye examination every 2 years. Under 16, typically again once every year, and over 60 or 70, depending on the area, it would be every year again as well. If you're more at risk of certain eye conditions, then, for example, if you have a family history of glaucoma over 40, everyone should have a yearly eye examination. Whenever you've had your eye examination done, at the end of the examination, the optometrist should tell you when you are due for or when you should come back for your next eye examination as well. So it should form a part of it, and or the prescription that's issued to you will usually have a small statement on the bottom as to when your next recommended eye examination should be.
Right.
That can sometimes change depending on what we find. For example, if we detect something that needs more closer monitoring, then we may ask you to come in sooner rather than the year or the 2 year mark.
Right, exactly. So for the audience of this webinar and our community who will likely have an IRD or supporting someone that will they likely be seen more regularly by an optician?
Yeah, again, depending on the condition. So often, arguably, you may be seen every year. However, if you're already under the hospital eye service and you're having quite frequent reviews there and things are being looked after, then it may be that the optometrist or the optician doesn't necessarily need to add anything further to the care. And as a result, it may be every 2 years. So that clinical decision is made at the time of the eye examination.
Right. And sorry, I'm asking further questions here. But if somebody is going to hospital appointments regularly, will that then be communicated to their optician?
In some areas, the communication systems are very, very good, where there's regular feedback between the hospital eye service and the community optometrist. In some areas, unfortunately, that system doesn't necessarily exist. Those areas, the GP is the central point of care, and often the hospital eye service letters would be sent to the GP. You can always request those notes or letters to be sent. My top tip for everyone would be, if you are being seen under the hospital eye service, to capture as much documentation as possible, meaning all the letters or discharge summaries from every appointment. Take those with you and pass them on to the optometrist that you're seeing regularly, or hopefully seeing regularly. That way, you can ensure that you're getting good transfer of information across the board and consolidated care across the board as well.
Exactly. Thank you for that tip. Now, when creating this webinar, obviously the title of the webinar is about what questions to ask and why they're important. So for people that are on the call today and those that might be watching after, the Retina UK team have come up with some questions that we think would be good for you to ask your optician, depending on different topics that we're going to cover. So under this first section, we have written Some great questions to maybe ask your optician at this point when you're talking about eye tests would be, am I eligible for a free eye test? And what documentation do you need to support this? I will be looking at the end tomorrow when I send out this webinar to write down these questions so that and we'll put them on our website so that when you are visiting your opticians, you can have this as a resource. Right, thank you. Now I'm going to move on to looking at regular eye examinations matter, especially for people with IRDs. So Ashish, I'm going to come back to you. For someone with an IRD who may be under the care of several specialists or none at all, could you explain why regular appointments with an optician are so important?
It's a great question. If you think of the optician or the optometrist as the GP of eye care, it would be, or effectively your primary care clinician. They would have almost a holistic view and take an overall view of the eye and the eye health. Of course, it goes beyond getting dispensed with the right pair of spectacles or contact lenses or whatever appliance you need to see or maximize your vision. It's really around getting an overall review and connecting the care and the support services that you have available to you. It may be that you're under several eye specialists. You might be seeing someone in the retina team, someone in the cataract team, for example, or glaucoma, or wherever that might be. Naturally, every clinician within a hospital setting should have access to each element within the pathway as well, so they can see what else is going on. But sometimes you also need a primary care provider just to connect some dots as well. So it's always important to have that touch point more than anything else. And as I say, the optometrist really would specialize in the corrective appliances as well. So be that glasses, contact lenses, or potentially low vision aids as well.
Okay, great, thank you. Anna, was there a moment when an optometrist spotted something important or explained a change in a way that helped you?
I can think of two. So one of them was a very, very long time ago. I was still under children's at the time. Yeah. But the optician basically explained to my mum, because I also suffer from photophobia as part of ushers, that actually getting her to trial a pair of glasses, even just once, with permanent tints might be really helpful. And ever since, I've had either a brown or a grey tint, which is my current favourite, at about 40%, which just takes the edge off really harsh white. So that significantly helps. And then the second one is to do with why you might be out of the opticians, but think your eyesight's going worse when you get a review from them, and it's basically the same. It's because they can't do all of the stuff that you do every day. So it's very clinical. You're looking at the screen, these are what you see. It's all very same, whereas day to day you have loads of different changes and stuff, which is why it could feel worse when it's not necessarily. They can't always guarantee it. But then equally, sometimes my optician will just change the contrast on the screen. So you don't have to have it as black text on a white background. My last appointment, she inverted all the colours, and I could do so much better than I usually can.
Right. So that's probably another question we could add to our resources. Can we? So would you say change the colour contrast of the test?
Because I walked in there, I was like, I don't know how much I'm going to be able to read of this at all. A, because of the distance. B, because of brightness from the screen. And she was like, oh, hang on, let me explore some of these buttons, and worked out she could change the screen colour.
Yeah. Is that how you found out that you needed to have a different colour tint on your glasses, or was there something before that?
The tint was already existing, but that was how I found out I needed that kind of contrast long term.
Yeah, that makes a lot of sense. That sounds really, really helpful. Thank you. That is a really great tip as well to share with our listeners. Joan, could I ask you the same question, actually? Was there a moment that an optometrist spotted something important or explained a change in a way that helped you? Oh, I think we may have Joan frozen. Oh, she's back. Hi, Joan. Sorry. You just freeze.
Sorry, I don't know what happened.
Absolutely fine. Don't worry. Sometimes the internet can be a little twitchy. I was just going to come and ask you the same question that I just asked Anna, which is, Was there a
Yeah.
moment that an optometrist spotted something important or explained a change in a way that helped you?
Yes, I mean, very much like Anna about lighting. I mean, the whole thing about retinitis pigmentosa, and I've been through a lot of changes in terms of lighting. So I've been playing with colors and all sorts of things over the years. And I found out that they can change the screen because I couldn't.
Oh, sorry, Joan. Okay, I'll continue talking, and if she comes back, we'll obviously listen to her answer because I'm sure it'll be
Where I
great.
needed a black background with white print, and they can do that as well. So all of those things were very important, including any curtains that are in the office that you go into for the eye test, you know, have that adjusted to what you can manage. So over the years, and it's been quite a few years, as I said, 50 years, I've had to deal with all of those changes. And I've also had tinted glasses in the past, but now I wear sunglasses, Ray-Bans all the time now. Probably my next step will be the Meta glasses.
Yes, great, thank you. Actually, I remember yourself and I, Joan, speaking when we were talking about this webinar about how, like you said, you've been going for 50 years. Could you have you noticed a change in how those appointments work over the 50 years?
Yes, I think in all honesty, because I went there before I got a guide dog. I then attended with my guide dog. I had to make sure my guide dog was comfortable. I even had to ask for the door to be shut because it was a very hot day, but it was noisy in the corridor, and because of my hearing impairment, it was difficult to hear what the optometrist was saying. So all of these things, I became more and more confident to ask what I needed, because at the end of the day, I wanted to know as much as them how much I could see.
Of course, of course. Thank you, everybody. So some questions we have written down for this part that you could bring to your appointments are: what changes should we be monitoring over time? How often should I be attending an optician appointment? And if I change opticians, are they able to see my prior history? Right, now moving on to what to expect at an optometry appointment. So Ashish, the next couple of questions are directed at yourself. For those who haven't been for a while or perhaps are nervous as to what to expect, could you please explain a little bit about what someone can expect when coming for their eye test?
Sure. So coming into the examination, there will be different practices will structure their systems in a slightly different way.
Yes.
One system could be that you'd come in, you'd check in at the front desk, then you go in and have what we call pre-screening tests, which effectively are a series of short checks and assessments and scans of the eye. Then you'd go in to see the optometrist, and you'd spend a certain amount of time with the optometrist who would do another further series of assessments and checks and tests. And at the end, they'd provide a summary and an outcome for you with a written prescription and so on and so forth. Some practices don't necessarily have that pre-screening element. The optometrist does all the examinations and tests. So you'd go check in at the front desk, for example, and then you'd wait for a short while and then see the optometrist directly, who would take a history and symptoms first, understand you, what your main challenges are, if you're struggling with anything in particular, and then do the tests accordingly. So there are differences across the board, but generally the rule of thumb, the way to think of it is you're going in, we need to do a series of assessments and checks, do some imaging to understand the eye itself, and then at the end we'd have a conversation with the outcome as well. Both Anna and Joan have been, it's incredible to hear that story and journey as well, in that it's really important to keep communicating, and if something's not feeling right or not quite right, everyone is there to help you, and everyone is there to support you, and everyone wants to understand your vision and your eyes as much as you say, as much as you do as well. So it's simple, and everyone is trained to provide and ensure that all the necessary adjustments are made to make your visit and your time there as comfortable as possible. So that communication piece is really, really important. So if something feels right or doesn't feel right, it's best to communicate that and speak up, and adjustments can be made accordingly.
That's great, and that really helps as well if people are feeling nervous, like you said. People just want to know and be communicative. Now, something we wondered is, are there staff on hand within the clinics to help with, say, accessibility needs, such as guiding, or maybe help with filling in forms or other support in accessibility needs?
Yeah, absolutely. So again, depending on the practice, there'll be someone whenever you come in. Again, there should be someone to greet you in most places, and again, just communicating your needs accordingly always helps them understand what you might need to help support your journey. Also, to fill in forms, again, there's usually people to help us support, and again, accessibility needs. It's best to call up the practice in advance, particularly if you need wheelchair access or I've got any other accessibility features that are required. Typically in your phone conversation when you come to book the appointment, or even if it's an online form or whatever, for example, usually there's a space to communicate any needs that you might have coming in. So at least they're kind of as prepared as they can be. Most of the time these are booked appointments, so the practice can prepare in advance for your visit. So as I say, the more information you provide, the more they'll be able to make your visit as comfortable as they can be.
Right. And some of our members of our community will have dual sensory loss, so visual and hearing. How are appointments made more accessible for these?
So optometrists all have training in ensuring that if there is dual sensory loss or if there are other accessibility needs, how to adapt eye examinations accordingly to ensure that we're getting all the information that we need from the examination and provide the right outcomes. A lot of places will have hearing aid support and loops, for example, and induction systems in place. Some places do, some places don't, but again, it's worthwhile contacting the practice in advance to understand that. Again, in the case of people who come in with guide dogs, again, just ensuring that you call up the practice and see what, for example, the size of the practice and how that might work. But yeah, generally speaking, as I say, most practices have, all optometrists have got training in this, and it's and adaptations are typically made. If you can bring someone with you, and if you need support, then again, it's always worthwhile. Or for example, in the practice, it's worth asking if you need sign language, for example, asking that question in advance of your visit. Not every practice will have someone that's sign language trained, but again, it's certainly worth asking the question.
Of course, it sounds like the top tip from this section is to ring ahead and just ask those questions and let the practice know as well.
Yeah, absolutely.
Now, when and why may an optometrist recommend specialist tests?
So the usual battery of tests that are done when someone comes to visit us is we have a standard set of tests that we do. Depending on the outcome of those tests, we often want to do further specialist assessments within practice. Certain tests like that might be an OCT scan, for example. It might be what we call contact tonometry, where it comes to checking the eye pressure in a slightly different way. There may be other tests in certain practices that are offered that aren't offered in others. If we're suspecting something that's slightly slightly atypical of what we'd expect to see for a person, then again, we'd often recommend specialist tests. And if those specialist tests aren't available within the practice, then we would refer to the hospital eye service or another specialist practitioner that may be able to offer these things as well.
Great, that's great to know. Now, Joan, thinking about all of the appointments you've had over those last 50 years, can you share a moment where you felt like an optometrist really got your needs during an appointment?
Sorry, can you repeat the question?
Of course I can, yes. I said, can you share a moment where you felt an optometrist really got your needs during an appointment?
Actually, it was very recently because the sight in my right eye has really deteriorated. And I was feeling it was pointless in going to the opticians because I thought, well, what good would it do? Well, anyway, I turned up and I explained, and they said, no worries, we'll just test your left eye, which is what they did. I mean, they did look into both eyes, but they looked into my left eye, and we did look at different lenses because I'm for both long distance and short distance. So I have just 2 pairs of glasses. And I was really impressed that we were able to improve both the long distance and the short distance. And to make sure that I could see the short distance, because I can't see printed material, i.e. White with black print, the optometrist gave me her mobile phone, and she did the contrasting colors on her phone and checked the sizing of the print to see how much, what was the best glasses for me for short distance or short close work, I should say. And I was thrilled. We got it spot on. It was really good. So I ended up having my same frames, but just changing the lenses of my left eye for both pairs of glasses. So I felt that I got a good service.
Right, that's a great story, and thank you. I'm glad to hear you had such a positive experience. It sounded like you really listened to. Yeah, it was really helpful. Thank you. And Anna, was there anything that made you feel especially supported during appointments?
You can touch on the contrast changing of the screens and
Yes,
stuff.
of course.
However, my local optician is walking distance from where I live.
Yeah.
So quite frequently I just walk into them to be like, can you tighten up my glasses? They've come loose and stuff. But instantly I walk in the door and they're like, hello, Anna, it's so-and-so at the desk. It's so small. You see like 3 different staff members at once, and they all know me. They all know my needs, which is say, tell her that someone is at the desk when she walks in.
Yeah.
And like when you go to upstairs, their room to get new frames is up the stairs. They'll always walk in front. I've been with my parents still, but they'll always walk in front up these stairs and be like, just watch this step right here as you come through the door. So they're always pointing out the annoyances of an old building that they've got.
Yeah, so it feels as if they really know you personally as well. Yeah, and did you say that you could just pop in and say, tighten my glasses, and they'll do it right there and then?
Yeah, pretty much.
Great. Yeah, that's great. Thank you both. Okay, so now Ashish just got a couple of questions about understanding vision tests. So when an individual with a suspected or confirmed IRD comes in for an appointment, do you have a standard list of tests you expect to perform, or is this considered on a person-to-person basis?
So whenever someone comes in, we do have a standard battery of tests that we would do. Those tests, in most circumstances, can pick up the presence of IRD. We would then recommend or consider additional tests to help us understand a little bit more. So, for example, an OCT scan or a different format of imaging of the back of the eye. All these things are things that can be, again, then considered on a person-to-person basis. The core tests will remain the same, so i.e. checking the vision, checking the refraction, so the presence of whether or not someone needs glasses, the eye pressure, for example, imaging of the back of the eye, a binocular vision function test, so an assessment of the muscles around the eye. All these things are quite standard. However, the second something is triggered or picked up, for example, that we think strays outside the norm, we may request these additional tests. And again, they can be done in practice or within a hospital setting as well.
Okay, great. So my next question was actually, is it a different list to the one you use for non-IRD individuals? But it sounds as if maybe there's a standard list and you add on for those with IRD.
Correct. Yeah, absolutely. It's typically added on. So absolutely. It's important to remember that the tests are all designed in a very specific way to pick up any ocular abnormalities. So It's or pick up change. That's the other important thing as well. So
Great.
clearly, both Joan and Anna have been great examples where they've seen the same practice or the same practitioner for a long, long time. So if there's any subtle changes or signs of change, that practice or practitioner can pick things up because they've got a history. That's another
Yes.
quite an important point there as well.
Yeah, it is. Anna, have you ever done a test at an optician appointment that maybe surprised you, something you didn't expect an optician to offer?
I was trying to think in the years.
Yeah, absolutely, don't worry.
I'm not very sure, to be honest. I've always kind of walked in there with some semblance of what I think they're gonna basically say coming out of it. It's like, pretty much I knew what I was walking into.
Yeah, that's absolutely fine. Joan, what about yourself? Have you ever had a test that surprised you?
Yes, I mean, I was surprised that an optician would check you out for glaucoma, but you know, I think it's an important one that most opticians do nowadays. And as Ashish says earlier on about, you know, hereditary conditions. I mean, I wouldn't know what hereditary conditions were in my family. I mean, I'm the only one who's got ushers in my family, so again, it was a shock and a surprise, you know, to be diagnosed with it.
Yeah, of course. Great. Thank you both as well. Now, for this section, questions we've noted down maybe that would be thought would be helpful to ask is, how will this appointment differ from a routine sight test? Can you explain what each test checks for? What does this test show? Has this changed from my previous tests? And how often should I have this test repeated? Right, so now on to some other questions. Ashish, why is it important for individuals and their families to understand why each test is being done?
Generally speaking, the more education the individual, the more understanding and education around the tests and eye examination the individual has, the easier our role becomes, because it helps us in the explanation and for you to take charge and ownership of your eye care journey. Generally, understanding each particular test is quite important because you understand what's been tested for. Of course, it's the role of the optometrist to connect the dots and put everything together. But just a general understanding of each component is always handy and useful. And as I say, when it comes to that baseline understanding of what normal is and what abnormal is, can also all feed into that as well. So long term, it's always useful to know.
Yeah, of course. And how can you help the person to get the most out of an appointment? For example, if they are fatigued.
So, for example, if someone is fatigued, so taking that specific example, if someone's quite tired, we've done a lot already, rebooking, having another day when, potentially coming back in for another day. It's worthwhile calling or just understanding how long appointment slots are for each patient as well. In some practices, there may be 20 minutes. In our practice here, we spend an hour with every patient. It just depends on the individual practice. It's worth understanding that. And if it's a shorter appointment, it may be worth asking, could you be booked in for a double slot, for example, because you've got a specific need? That also can be a consideration. So, and again, something Anna said, and there are adaptations that can be made during the examination to make things easier. For example, and Joan mentioned it as well in terms of closing the door, minimizing disruption and outside noise and disturbances. Additional light streams, for example, if there's often in this room, there may be lots of screens. So asking if certain screens can be switched off to prevent glare. Inverting colors and contrast, that can also be assessed as well or changed and amended. If someone's sensitive to very bright lights or flashes of light, asking that, perhaps if certain tests can be omitted or done in a slightly different way. It's always worth asking the question. And if there are certain things that, say, for example, if a flash of light, like a camera flash, makes someone uncomfortable or provides discomfort, there's other ways that we can do the assessment in the same way, but there may be a limitation on what can be done. So again, that will be communicated at the same time as the appointment.
That's good to know. And do you find there are any common misconceptions that people have about these tests?
Mm. Common misconceptions, I guess. That's a very good question. People often come in assuming also that the optometrist will be able to provide an immediate diagnosis or an immediate management or a solution to the problem. With these types of scenarios, it takes a team of people to really understand the eyes. Only an ophthalmologist can officially make the diagnosis of an inherited retinal disease, for example. That's one element. I guess the other misconception or the understanding is that, again, there's what a set of glasses, or there's going to be almost a miracle cure. Sometimes there's multiple avenues we can pursue, and sometimes a 10% improvement on a multitude of factors can help and amount to a large improvement, but it may not be a silver bullet. That's the other thing just to consider as well.
Yeah, of course. And from a patient's perspective, imagine that some tests can be quite uncomfortable. How do you overcome reluctance to do these tests?
It goes back to your first question in this section, actually. It's understanding why the tests are important and what's being tested for. For example, if we need to dilate the pupils, it does involve putting in some drops, and the drops do sting, unfortunately, but it does help us pick up much more and understand the back of the eye a lot better. For example, checking the pressure of the eye can sometimes be quite uncomfortable because in some practices they use a puff of air test. Sometimes in some practices it's a contact tonometer that's used. It all involves quite close proximity as well. So some of these things can be uncomfortable. The importance is, as I say, understanding what each part does and how that's going to contribute to the overall care and understanding of the eye. But also, again, going back to the point of just communicating if something can be adapted or changed during the examination. Just mentioning that you are uncomfortable with something or something doesn't quite feel right, by all means, things can be adapted and maneuvered such that we can make it as easy and as comfortable as possible.
Of course. Joan and Anna, on this point, have you either ever had to overcome reluctance during a test? And if so, how did you do this? Joan, I'll come to you first.
Yes, I mean, they did warn me about the pressure on the testing for the glaucoma. They did explain what it was for. And because I have had it several times over the years, it wasn't a complete shock, but it is unpleasant. It's not comfortable. The other thing that I don't like very much is the light that has to be, shining in your eyes. I understand the reason for that. And the way I treat it is that I think of it, it's only going to be a few seconds, few minutes, not longer than that. And I'm very conscious of the fact that the ophthalmologist never wants to put me in any pain, unnecessary pain. Yes. So I just have a lot of faith in them to do what they need to do.
Yes, they're doing it because it's needed, of course. Anna, what about you?
So the test. So the one where they dilate your pupils to do the photos in the back of your eye, those drops are horrible. I do not like those drops at all. So I understand why you did it. What's needed behind them? My mind is always thinking, the reward that could come later. I treat myself after some tests, and you need a sweet treat.
Nice tip. Yeah, agree. Yeah, get a nice pastry or something. Yeah.
Yeah. But that's also the same for the ones where they take the photographs. Mm-hmm. Not all are created equal, but there is a particularly horrible one where they shine, like it uses that really prolonged, massively bright blue light. Mm-hmm. That's painful. With photophobia, that one's actually painful. So I'm always just like, I give it 1 or 2 shots. After that point, I can barely tolerate it. So it's like, no, I'm sorry, can't do this. And then I was like, that's fine, we'll move on.
Yeah, but like you said, you communicated, you'll give it a shot, and if not, you'll get a sweet treat afterwards anyway. Great. Yeah. Great, thank you. Right, Ashish, are the results from optician appointments shared with the GP or ophthalmologist? If not, can patients request a copy of these results to share with them?
Absolutely. So typically the results aren't necessarily shared unless an abnormality is found and we're referring. You can request a copy of the results. It would be a case of writing to the practice and requesting the results, and say a copy of any imaging that you may want.
Great, thank you. And Joan, have opticians helped you access other services on your sight loss journey? And what was that experience like?
Well, actually, I was thinking about how they've helped me. I can't actually, because I've been in close contact with Moorfields. They gave me a lot of information about guide dogs. I was put in touch with before Retina UK was called Retina UK. So I've known the charity for a long time. So I had a lot of information. But the one thing that I did find out, which interestingly, my optician actually was offering discounts to people who work for the local authority. And I worked for the local authority for 25 years. So I actually got a discount with my when I purchased my frames at the optician. So I thought that was a very helpful thing for me.
Yes, that is. I'm glad to hear it. And Ashish, back to yourself. How do opticians refer and work with low vision services to support functional vision and independence?
So it depends on the area often. So within London, for example, we a lot of low in most areas or most boroughs, low vision services are held within the hospitalised service. So the clinic or the practice would review if they feel prudent or appropriate, then they can refer to low vision services. That's normally done either via the GP or a direct referral to the hospital. Within low vision services as well, or within hospital settings, there are also ECLOs, eye clinic liaison officers, that can also support the journey and support as well. So typically it's an onward referral. Some practices offer low vision services in-house. That can be done. Sometimes that's NHS funded, or it can be private as well. It just depends. And of course, there are lots of charities as well that can support with the same.
Of course, yeah. So the questions we have written down for this is, can you help me access other services, and how do you communicate findings with my wider care team? Okay, now that kind of finishes our discussion portion of this webinar. Thank you all for your time to submit questions this evening during our Q&A, and we also received a number of questions before our webinar began, so thank you for that. We're now going to move on to that portion. Ashish, a lot of these questions, like I said earlier, are directed at yourself, and I understand some of them might be a bit personal, so if you could answer as you can. One says, I'm living with a sight loss condition. When choosing an optician, is it best to go to an independent optician or an optician on the high street / a big chain?
The important thing to remember is to develop or try to develop a consistent long-term relationship with whichever practice that you choose. There are some fantastic independents. There are some fantastic high street opticians or big chain opticians. The important thing is trying to get consistency as and where possible, trying to see the same person, if not at least the same practice. Developing that relationship so you're familiar with the environment and the setting, and as you go in, you recognize the staff and the team that's going to be looking after you. Those are the key tips that I would give. I think, again, you can go either way. They've both got their pros and cons, but I think the important thing is to find the setting that you're most comfortable with.
Great, thank you. The next one is it part of your professional training to ask people who have a known underlying disorder how it affects them in engaging with optician appointments? This person said they had a really valuable experience when addressing these issues with their local university optometry school.
This is a really good point. So yes, during every optometrist undergraduate training, we're all taught to understand how to adapt examinations to specific needs. And yes, an optometrist should be asking if there's anything that would help or assist with engaging with the appointment as well. In most practices, again, it could be a part of a standard kind of questionnaire or the appointment booking process as well. So it is it's a part of the training to make the correct adaptations accordingly.
Right. How do you ensure eye tests are accurate and that patients who may struggle to communicate fully understand and feel confident in their prescription before they're encouraged to buy glasses?
So I'm assuming this one relates to the spectacle prescription and how to find that. So there's two elements of deriving a spectacle prescription. So firstly, you've got your subjective measurements, you've got your objective measurements, and then you have your final given prescription, so to speak. Usually the final given prescription, so what's eventually made up into your glasses, constitutes both subjective measurements and objective measurements that are taken during the examination. That given prescription should only ever be given anyway if the practitioner or the clinician feels confident that we've reached a good endpoint on and a good result with that prescription that is fit enough to be prescribed. If it's not, say, take your early example, if the person's quite tired and finding it difficult to engage, and we're getting a very variable endpoint, so to speak, with the prescription, then we may choose to rebook or revisit another day or refer on to an appropriate practitioner that may have more experience in that particular condition. So, in I guess a long answer to a short question, it's important that the practitioners are all trained and they understand, or they should understand how to navigate this. Can be quite a complex process. It's important that the person receiving the examination also communicates if they feel that something is right or isn't quite right at the end as well, and that adaptations at the end can be made as well. And for example, we can always revisit things going forwards too.
Yeah.
Occasionally, of course, mistakes are made. A pair of glasses, for example, may be made up. They're not quite right because there are subjective elements to the examinations as well, and things do go wrong. Again, within a reasonable time frame, it's important to go back to that practice and have that discussion and say something doesn't feel right. Can we relook at this? And the practice should be, and everyone is obligated to recheck a prescription as and when required.
Right. Another one we have is, are optometrists successfully able to track the progression of retinal dystrophies? This person said their daughter has rod cone dystrophy and an optician said it was stable, but when they had an ERG test, it turned out it progressed significantly in the left eye.
It's a very, very good question, this one. Again, it depends on the practice. Some practices have got quite a lot more advanced equipment that can pick up and track certain metrics. Some practices have slightly more basic equipment. It's down to the practice and the clinician to understand the limitations of their practice, and what they can and can't do, and communicate it accordingly. Again, there are a variety of conditions. Not every practitioner knows everything about IRD, so they would refer on to the appropriate place to ensure that there's continuity of care. In some scenarios, people may be discharged from the local hospital eye service because they're better served in the community for ongoing monitoring, and that would often be written in discharge letters and summaries as well. So if, for example, if you ever get to a point where you're being discharged from the hospital eye service or from any particular point of care, it's important to ask for that correct documentation to take away with you so you can communicate to the person taking over the care how things are going to be looking going forwards.
Great. I just have one more for yourself. This person says they have RP. What can I do to preserve my remaining vision?
Regular examinations are really key to check for any other things that may be developing alongside this. So, for example, cataracts or any edema at the back of the eye, at the macula. Just a general healthy diet and lifestyle always helps. Lots of leafy green vegetables in your diet. UV protection helps as well, so wearing a cap or UV protected sunglasses. All these are little factors that can all help to maintaining as good, preserve as much vision as possible.
Great, thank you so much for answering all of those in quite a quick fire way as well. Actually, Joan and Anna, we have one for you as well. Joan, somebody has asked yourself, what makes an optician appointment feel positive for you?
Well, I always prepare myself before I go, because I always feel anxious in going. I give myself a lot of time to get there and settle myself. And I think because I've seen the same ophthalmologist recently, over the years, we're on first name terms, and that really does make me feel really comfortable. And I just make sure that before I start being tested, that the actual surroundings are comfortable. So in other words, handbag on the floor, curtains closed or however, and then when I feel really relaxed, I can get started.
Yeah, great. Thank you. That's really helpful. And Anna, what practical tips would you give someone who's maybe feeling nervous about going to their optician?
Just for me, it's about being open to the optician. It's like, this isn't working. Because if you have a negative experience once with anything at an optician's or even hospital eye examinations, that's going to affect it all long term forever. You're always going to constantly revert back to that one bad experience, despite the fact having like 10 more positive experiences. So it's for me, it's about honesty and being open with them. So like when I was open with the fact that I was like, I don't know how much I'm allowed to read of this because of the glare and stuff. She was like, let me press some buttons. I'll see if I can change this. She didn't even know she could do that herself. It was just like, I think I can do it.
Yeah.
But yeah.
Yeah, and like you said, they see loads of different patients, right? So they'll be accustomed to dealing with lots of different anxieties, and like Ashish said, adaptations can be made throughout all the appointments and through all the tests.
I think as well, though, just being open, because you don't want one bad experience just affecting the rest of your life going to these appointments.
No, completely agree. Gosh, thank you all so much for joining tonight's webinar. I think this is a conversation we actually could have had for another half an hour or so, but this is scheduled for an hour. But I can't thank you all enough for coming today with all of your expertise and knowledge and sharing that with us as well. Just to close out tonight's webinar, if today's discussion has sparked more questions or you'd like to explore these topics further, don't forget that we also have a podcast channel. Our podcast can be found on all major platforms under Retina UK, and we have another episode on there titled Eye Tests. Find out more about what to expect at appointments, and in it, guests including research and clinical experts break down different tests and how they fit into your eye care pathway, aiming for you to understand your results and be prepared for future visits. All of our webinars and podcasts are part of our commitment to giving you the knowledge, tools and support you need when you're living with an inherited retinal condition yourself, or supporting someone who is. For more resources, support services, our helpline and upcoming events, do please visit our website at retinauk.org.uk. Thank you all again for joining us tonight. Thank you to our 3 guest speakers, and I look forward to seeing you at future Retina UK events.